Hello everyone, good afternoon. My name is Miraselua and I have an interesting topic for us today, which is low sperm count. I have a doctor with me and also a fertility specialist who is going to be the judge to the questions I have for him today. So Dr. Oxford, can you tell us what low sperm count is?
All right, so low sperm count simply means when you go to the lab and they do sperm analysis for you, and then your sperm count is less than 150 millions, okay, per cubic meter. It means that you have got low sperm count.
Okay. Is there any difference between low sperm count and low sperm motility?
Yes, there's actually a very big difference, and we have seen in clinics today that most people I don't know how best to say it, like people that have low sperm count are being told that they have low motility. People that have low motility are being told that they have low sperm count. But
All right.
it's actually a very big there's actually a very big difference. Now, when you can actually have low sperm count without necessarily having low motility, and vice versa. Now, you are told to say, or rather, you have low sperm count if your sperm count, like the motility is less than 30%. So
Right.
we have 100. It's supposed to be at least 80 to. It's supposed to be 70 to 80%. But when your motility count is less than 30%, we say you have got low motility.
Okay. Can you also tell us the causes of these challenges? The low sperm count.
Yes. Okay. These are regular questions we get in the clinic every now and then. Now, there are a lot of things that can actually cause you to have a low sperm count. Okay. Now, it starts by the kind of lifestyle that people live.
All right.
Okay. Now, first of all, somebody that engages in long distance driving, okay, are bound to have a low sperm count. Reason because people who involve in in a long distance driving tends to stay on a chair which is sometimes overheated, and this reduces the testicular production of sperms, and they tend to have low sperm count. This can be one of them. Then there are also other things that can also cause you to have low sperm count, which includes infections. Okay. Now, oftentimes when people get infected, you see them going to the hospital or going to the chemist or going to the pharmacist, and when they go to the pharmacist or to the chemist, they are being given some medications. Sometimes these medications are the right medication that they're supposed to take, all right, and when they take them, some of them don't complete it, and when they don't complete it, these infections are not totally cleared off, and you see this infection eating up into their testicular cells, which are responsible to produce sperm counts, and this can make them to have low sperm count. Okay, and other things that can involve is in today's world, we're exposed to radiations, we're exposed to our phones. Now, we're not saying that all phones can actually cause you to have low sperm count, but sometimes when you're exposed to radiations like the phones, like when you go to the bank, all right, and walk into their mercury doors and stay there over a period of times, this somehow has a way of affecting your testicular productions.
Okay.
All right, so these are some, and there are many things that can actually cause it, but these are a few of them.
Wow, thank you, sir. So lastly, I want to ask, is there any treatment that can be profound for these challenges, or what advice can you give to people out there about this?
All right, now, first of all, what I usually tell my patients when I see them is, one, you need to first go and see a doctor. And the best doctor to see here is a fertility doctor who can actually be sure that, yes, you have a low sperm count, because you may just be having a low motility and it's being misinterpreted to be low sperm count. So first first make sure that you're seeing the right person, which is a fertility doctor. All right. And that is one. Then secondly, when haven't seen your fertility doctor should be able to tell you if it's what could be responsible for your low sperm counts. All right, could it be something? Because now there are different stages that a sperm is being produced. Okay. Now there's a signal that comes from the highest point. We call it the hypothalamus. Okay. And from the hypothalamus, it goes to another point we call the pituitary, and then from the pituitary, it now goes to the last point we call the testis. Okay, so if there's a problem coming from the hypothalamus and you're busy taking some other drugs that can affect the testis, you're just wasting your time, because at the end of the day, the problem is not well sorted where it's coming from. Or if you're having a problem from the pituitary and you're busy taking hormones that can affect the hypothalamus or the testis, you're obviously also wasting time. All right, or if the problem is also coming from the testis and you're busy injecting or taking tablets that can affect the hypothalamus or the pituitary, the person is also wasting time. So in essence, what I'm trying to say is that now there are a lot of things that can cause there are different stages that somebody who is having low sperm count can actually have. So it depends on where your problem is coming from, and that depends the solution. So, and the only person who can tell the best problem you're having and what is causing your own problem is a fertility doctor. And this is also why I'm strongly recommending everyone who is watching this video to see their specialist who can tell them where their problem is coming from and be able to give them the best solutions for their problem. Is that okay?
Yes, sir.